Sway Health.
Hi, I'm Brittany Quemby, Vice President of Marketing at Sway Health, and I'm here with Adam Turinas, founder and CEO from Health Launchpad. Welcome, Adam.
Hello, Brittany. Thank you for having me here today.
So today we're going to learn a little bit more about Health Launchpad and what you have to offer our attendees and our listeners. You are an upcoming sponsor at our Sway Health Live event in April. So let's get into it. Can you tell us a little bit about what problems Health Launchpad solve?
What a great question, Brittany. I can just get a little bit, I want to go back a little bit to the problems that I lived firsthand. So before starting Health Launchpad, which I launched in 2020, I was the CEO and founder of a health tech firm. So we were in the clinical communication space and we sold to healthcare systems and payers and ACOs and organizations like that. And we were pretty successful. And eventually we sold the company. But the constant problem that we had was that it didn't matter what we did from a marketing standpoint. We could never really figure out what was working and what wasn't working. And For me personally, as somebody who'd been a long time marketer, I'd spent a couple of decades in marketing before I started my software company. It was incredibly frustrating. So when I founded Health Launchpad, what I wanted to do was address the problems that I was living. And when I talk to marketing people, here are the constant themes that we hear, which is the tactics that we've used in the past, the kind of typical demand generation tactics, just don't work as well as they used to work. And it's really hard to figure out what's actually generating demand and how to do that as effectively as possible. And there's been a lot of talk about account-based marketing as being a way to do it. And for a lot of people, that's quite overwhelming. So that's another issue that we were dealing with. But in general, the question that we're helping our clients answer is, how do we generate pipeline in the most effective way possible using the most modern marketing techniques? So that's the number one problem that we're addressing. The other problem that we're helping clients with is like, well, it's maybe more of an opportunity, which is how do I use AI effectively? What are the ways? What are the use cases? What are the opportunities for using AI to improve the productivity and effectiveness of our marketing?
Great. And you talk about kind of the addressing those problems. Folks who are going to come, speak with you or see you at the event, what are some of the services that you offer at Health Launchpad that, would benefit them?
So we offer three types of services. So number one is pipeline growth services. So that's primarily account-based marketing, but we have a number of different ways of helping our clients with demand generation. And we have a tech stack that we've essentially assembled. It's sort of what's called unbundled ABM. So rather than having to go out and buy demand base, we actually rent a tech stack to our clients as part of that services. And that includes solving one of the other big problems, which is how do you measure the effectiveness of what you're doing? So measurement and optimization is a key part of what we do. So that's number one. Number two is messaging and content. Because while we might be obsessive about sort of demand generation and ways of targeting the audience in a precise way, if you don't get the right message and the right content in front of them, you're not going to get a result. And so we have a methodology for the way that we create messaging and for the way that we create content that converts really, really well. So that's number two. Number three is there are a lot of different strategic problems that clients have that are sort of point issues. Like, for example, how do we measure the economic impact of what we're doing for our customers, and how do we translate that into greater demand? So, for example, one of the things that we do is called an economic impact model. So there's a wide range of different things that we do. We do custom research, we do customer research as well as custom research, and things like that all underneath an umbrella of strategic advisory services. And so that's sort of essentially is if you've got you want to get some fresh perspectives on how to generate pipeline, on how to do messaging and content. And if you've got sort of different particular sort of like really tricky strategic issues that you're wrestling with, have a chat with us and we'll be at the show. There are going to be, I think, 5 of us at the show. Myself, my colleague, Mark Erwick, who's our chief strategy officer. He's a longtime Sway participant. Leah Chatham, who's another member of our team, also sort of been a CMO and involved with Sway way sort of early days of HitMic. And then 2 of my other colleagues, I think it's their first time at Sway, Justin Metz, who's our content lead, and Paul Vondra, who's our digital marketing lead. So look out for us. I'll be there. Mark will be there. Lee will be there. Paul and Justin. I don't know how to say how we're going to be standing out. We'll just be around networking and we'll be in the event. The other thing is that we are also going to be speaking. I think there's a session on ABM, and it'll be about the ABM journey. And we're lucky to have one of our clients come along and talk about the early journey with ABM. And then that's Eric Johnson from Harmony Healthcare IT. And alongside him will be Mark Erwick, who'll be talking about, well, once you've been doing ABM for 4 or 5 years, what does that really look like? Because he is I mean, he's been doing ABM for longer than I can even spell it.
So you're going to be speaking at Sway Health Live, which is great. So people can come find you at your session and take in all the great ABM content that you're going to have there. Also, just walking around. So come up to yourself and Mark and the other teams to, really talk about the services that you have to provide and how you can help them. And I love that term you said, unbundled ABM. I feel like that's going to be ringing in my head for the rest of the day. So I think, people will love to be able to talk to you about that. Adam, for the folks who may not be going to Sway Health Live, which they should be, but if they're not, where else can they go to learn more information about Health Launchpad?
So our website is healthlaunchpad.com, all one word, healthlaunchpad.com. And you can find me on LinkedIn. I'm the only Adam Turinas that I know of. And you can also follow Health Launchpad on LinkedIn as well.
Great. Well, Adam, I'm looking forward to seeing you in basically a month. We're so excited about everything and so excited for sponsors like yourself to help make this conference possible. So we're so excited to see you and excited to see everybody there.
Can't wait to be there. This is, I think, only my 3rd time coming to Sway, and I've just loved it every time I've been.
Well, thanks so much.